Healthcare industry leaders grappling with the public response to the killing of UnitedHealth CEO Brian Thompson and assessing whether changes need to be made in the industry. Yahoo Finance spoke with Mark Bertolini. He is Oscar Health CEO and the former CEO of Aetna. Here's what he had to say.
While this act in itself was unconscionable, the behavior of the American public in reaction to it is understandable given how frustrated people are with the state of our healthcare system in the United States.
Joining us now with a look at how the industry is responding, we've got Mike Desjadon. He is Anomaly's CEO. Mike, thank you for coming in here. I just want to get your reaction both to what you heard from Mark and how you're kind of viewing the response that we've seen from the public to this.
Yeah, sure. Thank you for having me. I wish it was under different circumstances. It's a worthy conversation. I had a chance to catch your segment with Mark live, so I've been thinking about this for a bit. And Mark's a guiding light in our industry. I think the first thing I'd say is one of the things that I've been viewing and maybe struggling with is some of the moral equivalency that folks are talking about here. I want to make pretty clear that what we witnessed was a crime against a person on their way to work, and a crime against the society that we go to work in every single day. And today it was healthcare, and tomorrow it could be any other industry. So I think my own personal reaction is surprise there.
How are you looking at this as a healthcare CEO, just in terms of the reaction? While it is a tragic event, I think the industry just can't dismiss some of the outrage and unhappiness that we certainly are seeing play out within the sector and with the insurance industry at large. There are some changes that have long been advocated to change within our healthcare system. What are those? Or I guess, what do you think is the most necessary in order to start on that path to improving the healthcare industry?
Sure, great questions. And the word actually I liked most was long. These have been challenges that we've been struggling with as a country for almost 80 years. That was actually one of the things that Mark did say in the segment that made a lot of sense. I mean, ever since employer-sponsored healthcare, things have kind of gone awry. A company I used to work at, the advisory board company, we did a survey of people's views on healthcare. And this was more than 12 years ago. And we ranked all healthcare, not just health insurance, but right next to the IRS in terms of people's kind of Net Promoter Score. So this is a big challenge, and I think there's lots of complexity here, and there is no single segment to blame. But I would say it starts with, in healthcare, there is no real transparency, and there's no real agency for you and me. If something goes wrong, who do we call? Where do we go? We don't know what things cost. We don't know what things are covered, right? We're told what to do in healthcare, and I think that's where it starts. I mean, a good analogy. Most folks don't kind of know the guts of healthcare, but a good analogy. Today. Before I came here, I went to get coffee, right? I chose the place I went. I went to Gregory's, it's pretty good. And I chose what I wanted. I looked at the price. I live in Virginia, it's $4, New York, it's $8. But I agreed to pay for it. And when I left, no one's gonna run me down for bills. Nothing's happening behind the scenes, right? We don't have any of that in healthcare. Somebody tells you basically what doctor to go to. That's usually your insurance carrier. Your doctor will tell you essentially what you need, right? And you trust that that's the right thing. You've already paid for your insurance, you trust it's gonna pay. You leave, and hopefully, you're on the path to being well. But so often in healthcare, behind the scenes, there's this whole industry figuring out what to bill and whom to bill. That part of healthcare costs $500 billion a year. And it's done wrong more than 20% of the time. So to you might not get a bill, you might get a bill. And if you do, that bill might be $4 and it might be $84,000, and you really have no idea why or nowhere to turn.
I think that's such an important pain point for individuals. It could either be $0 or hundreds of thousands. It's very difficult to suss out the exact price of these goods. And I wonder what you think about whether companies should be in charge of fixing that, or if it should be something that's coming in terms of regulation moving forward. And this is something that California Representative Ro Khanna spoke about earlier this week. I want to get a listen to that and then get your response.
Sure.
There is no justification for violence, but the outpouring afterwards has not surprised me. My view is very simple. Why can't we have a rule that if a doctor prescribes something and if Medicare, traditional Medicare, is going to cover it, then private insurance companies should be forced to cover it? I mean, it's absurd in this country what's going on.
So this is a debate that is a tale as old as time. Should it be private or public sector regulating this space? What do you think?
Sure. We already have a public-private partnership in this space, and almost except for the extremes, that's probably what we're going to have moving forward to try to get Capitol Hill and HHS and what we all want to line up is quite difficult. So I do strongly believe that there is a private sector solution here in partnership with government. And what I bring it back to is you get what you incentivize everywhere, not just in healthcare, right? So I think a lot of what folks talk about is that, we have a sick care system, not a healthcare system in the US. We incentivize kind of after the fact, you're sick, intervention, right? And so much of that is high cost items, surgeries, for example. So I think some of what we're starting to hear potentially from the new administration is looking at that kind of a payment scheme. Might we incentivize, healthcare, primary care, mental health, more than kind of incentivizing, high cost surgeries? Not that those are going to go away. We're, a great foundation for innovation, but you got to look at what you incentivize, and that really does start with government. So much of kind of the health payment scheme really is set in Washington, and then commercial insurers sort of largely follow suit. And most healthcare in the United States is distributed through Medicare. And it's important that we get that right at the top. And then there's complexity. That also has kind of a public-private partnership. So my company, we kind of live in the guts of health payment. Our goal is to simplify it. And one of the things that we look at and kind of live in is the system of codes that the health system relies on to understand what to bill. And this is something that the incoming Trump administration has actually talked a lot about.
How do you simplify it, right? Just in terms of, I think so many people out there are just trying to figure out the path forward and what ultimately this looks like and how this is going to affect them specifically in their billing, and for investors out there, how it's going to affect the space and some of these share prices a little bit more broadly. When you talk about the introduction of AI, the disruption that is leading to, obviously something that you're working with here at Anomaly, break that down for us, just more specifically what that looks like.
Yeah, so I would say the U.S. healthcare industry is, an elephant. We're talking $4 trillion going to $6-8 trillion in spend, right? So we're not going to change this overnight, even if we have all of the powers of government and industry lined up. So you got to approach it in chunks. So in the ethic of crawl, walk, run, for starters, approach transparency and agency. We got to start to simplify payment before we can make payment make sense. Simplifying it means, okay, we need to know how much things cost. There's been some legislative and some administrative action there. There's a lot of technology in that space right now. The second component, what we do, is figure out what's in health plans. Know before you go on what actually is covered, so you can make the appropriate changes before you get into a doctor's office. That's how you start to attack that $500 billion in healthcare spend. And it's not a perfect place to start, but if half of that $500 billion is waste, we're talking about $250 billion that we can immediately take out of the system, literally by just transacting better between provider and insurer. That's a great place to start while we think about some of the bigger, more systemic changes to incentives and structures.
Mike Desjadon, thank you so much for taking the time to join us here, CEO of Anomaly.